My name is Dominique Davis, and welcome to the Equity Exchange. This is a new virtual event from the National Institute for Children's Health Quality. At NICHQ, we work on improving systems of care in maternal and child health, with a commitment to equity in all its forms, with regard to race, color, ethnicity, nationality, gender identity and expression, sexual orientation, age, ability, or religion. Equity is one of NICHQ's core values, and in 2022, we launched our Department of Health Equity Innovation with the goal of accelerating strategies that address systemic health inequities, which we know disproportionately affect BIPOC children and their families. The Equity Exchange is a revisioning of a webinar experience, so our time today is structured so you can contribute too. We'll begin with some shared learning, followed by a focused discussion with Dr. Stacy Scott, our Vice President of the Department of Health Equity Innovation at NICHQ. And after that, we'll engage in moderated breakout rooms where you can share your perspective. Then we'll reconvene for a report back and share some of closing action items that you can implement into your practice. Toward the end of our hour, you can join Dr. Scott and our guests in a virtual reception room where you can freely speak and share your thoughts and questions. Through the course of this series, we'll explore emerging equity frameworks and speak with leading health and equity experts about important topics like reproductive justice, equity fatigue and weathering, and institutional power dynamics, and what you can do to address them in your work and at your organization. Today's conversation will focus on the state of equity and the Equity Systems Continuum, an evidence-based framework for looking at racism in organizational systems. We have an exciting hour planned today. It's full of rich discussion and information and resources to share. Thanks for joining us in the Equity Exchange. Here we go.
What a time to be in DEI, inclusion, belonging, equity. Who would have thought that these words and their definitions would be used against the very folks working to create more inclusive environments in their communities and states? After the murder of George Floyd in 2020, we saw organizations across the country in all sectors make commitments to strengthening their diversity, equity, and inclusion efforts. However, in the following years, we've also seen record legislative and social pushback to equity efforts, with many organizations falling short of completely abandoning commitments made. Protection that groups have fought for and won in the past are being repealed, from reproductive rights to affirmative action. We've seen the polarization of policy, with leaders restricting the use of DEI policies, such as Governor Abbott of Texas, who in February 2023 directed state agencies to stop using DEI policies. Independent newspapers, the Texas Tribune, reported that Andrew Eckhouse, an Austin-based lawyer for a Kaplan law firm, which specializes in employment and civil rights litigation, said that the governor's office was completely miscategorizing DEI's role in employment decisions in an apparent attempt to block initiatives that improve diversity. As Eckhouse acknowledged, DEI initiatives work in tandem with existing anti-description laws to encourage companies to solicit applications from a wide range of people, and this benefits us all. Months later, the impact of this directive was troubling. DEI offices on campus were dismantled, and chancellors reported that recruiting faculty became more difficult. And that's because, according to the Pew Research Center, most people support DEI efforts at work. The 2023 survey comes at a time when DEI efforts are facing some backlash, and major companies are laying off their DEI professionals. 56% of employed adults in the U.S. say that focusing on DEI at work is a good thing, compared to a neutral 28%. 16% say DEI at work is mainly a bad thing. So what are we to do with this mixed message? It can be challenging to continue our equity efforts despite the pushback, but we know this noise is a distraction, the response of a privileged group when that privilege is challenged. We can stay committed to the principles that are proven to improve health disparities for those most affected by discrimination, bias, and racism. The most effective DEI efforts use the theory of target universalism, the idea that everyone benefits when the most marginalized groups are considered. According to a primer published by the Haas Institute for a Fair and Inclusive Society at UC Berkeley, target universalism is an approach that supports the need of a particular group, even the politically powerful or those in the majority, while reminding everyone that we are all part of the same social and civic fabric. You may have seen a version of this image. The fence imagery aims to distinguish between equality, meaning strictly equal treatment, and equity, or fairness. In the equality version of the image, people of different heights and abilities are given equal-sized boxes. But we can see the same box doesn't help people who are different see over the same fence. Targeted universalism does advocate for different people receiving different strategies or resources, but we can gather that's necessary for everyone to meet the universal goal, for everyone to see. So the larger question may be, how do we remove the fence? That would allow the most people to experience the gain. It's a solid metaphor for structural change, something more durable that benefits everyone. In 2020, NICHQ hosted a series of webinars focused on health equity, culminating in the introduction of the Equity Systems Continuum, an evidence-informed conceptual framework developed in partnership with the Global Infant Safe Sleep Center. It describes and defines the systems that individuals and organizations currently operate within. In this framework, the systems are defined as supremacist design systems, savior design systems, ally design systems, and equity-empowered systems. Supremacist design systems, regardless of the intent, maintain inherent structural biases, reinforcing and perpetuating inequities that have long been entrenched in institutions, policies, and community relations. Savior design systems were originally designed to rescue, save, or deliver services to historically marginalized communities by members of the oppressing communities. However, these systems do not consider the root causes and institutions that create marginalized populations in the first place, and include policies and practices that harm specific racial groups while benefiting or centering others. Ally design systems acknowledge limitations of the overall understanding of disparity groups' experiences, but do not use these experiences as a reason to act. These systems reflect on lived experience, points of privilege, and oppression to inform additional perspectives needed for discussion and decision-making, and they attend to identify and challenge institutional and systematic oppression. You might hear this description and think, this sounds pretty good. While many ally design systems are well-intentioned, these systems often create environments with paternalism, tokenism, and monological approaches that don't include voices of disparity groups, leading to work that is not reciprocal, reflective, or truly participatory. As we think of this continuum, our goal is to create equity-empowered systems built and governed to center on experience of disparity groups. These systems accept racism and other forms of oppression that adversely impact systems of care and pay specific emphasis on addressing unique needs and root causes of inequitable outcomes. Equity-empowered systems deconstruct institutional racism and systematic oppression and reconstruct systems that are rooted in advancing equity of historically marginalized groups. In an equity-empowered system, there is shared power, diversity representation, and a redistribution of resources to establish equitable decision-making, design, and implementation processes. By mapping this continuum and giving each system a name and definition, we can consider where our current approaches have succeeded and failed, and what we need to do to improve. This framework can give us a tool and additional language to assess our surrounding and navigate the current DEI landscape. We are already seeing indications that 2024 will bring continued legal challenges to the ways we do DEI work. From errant billionaires tweeting their "I'm rubber and you're glue," messages of refusing to call racism what it is, to the power of lobbying, one thing is clear. We will need to pivot too, because at its heart, this important work to ensure that access really is equal, that the color of your skin shouldn't determine whether you live or die while seeking medical care, support from services like law enforcement, or simply existing in public, DEI benefits us all. Despite what impression the noise is trying to generate, the data show that most people believe DEI-related policies and resources have had a positive impact at their work, including hiring policies, affinity groups, transparency around salary, dedicated DEI positions, and workplace trainings. Let us stay the course together, sharing our challenges, successes, and strategies for moving toward these universal goals of access, opportunity, and health.
Welcome. Thank you so much for joining us today. I am so happy to be able to be here with you. And what I'd like to do is, again, want to get right into it. I am Dr. Stacy Scott, as you may know by now. And our goal is not to be an entry-level equity 101. There's a lot of accessible and reliable resources for learning on equity. Some are included in the platform here today. And that said, it's important for us to have shared language for meaningful conversations ahead in each iteration of our equity exchange. We look forward to exploring content that takes us further into the work of improving maternal and child health. We also want to make sure that we have a space that is open and honest for conversation, collaboration, and innovation. So with that, I'm going to begin to introduce two of my colleagues. First, Avery Margenot, who is actually a certified doula. She serves as an equity consultant with Global Infant Safe Sleep Center. She's an operation manager, sexual reproductive health at Cityblock is where she's employed currently. She's a public health practitioner. Avery approaches her work with a racial and reproductive justice lens to build more equitable systems for children and families. She has experience working with diverse stakeholders on programs spanning sexual and reproductive health, early childhood systems, building and expanding access to doula care. She is passionate about amplifying community voices and shifting power within systems to support families to thrive. Our second person today, a dear colleague, is Michelle Edison. She is Director of Network Development at Pathways Community Hub Institute. Michelle is an accomplished and award-winning Director of Health Equity with 20 years plus of experience driving innovative public health equity initiatives. Michelle champions a collaborative leadership approach to building high-performing teams and engaging community partners, agencies, lawmakers, and stakeholders to envision and employ equitable change. She is nationally recognized as a voice for public health equity, racial health disparities, infant mortality, and children's health policy. So with that, I am going to begin with Avery, And I'm going to pose a question to both Avery and Michelle. And I'd like to start out with reflecting on the state of DEI now in 2024. What can individuals do to help make systems level equity improvement changes within their organization? Avery?
Thanks, Stacey, so much for your question, and hi, Michelle. And thank you, everyone, for attending. It's really exciting to see how many people have joined today. I think as we're really reflecting on where we're at today, everything that the video mentioned, we're seeing pretty, I think, distressing responses in many states to the national momentum that has been garnered around movements like Black Lives Matter, reproductive justice movements, trans rights movements. And that backlash that's happening is, I think, something that we see, and we've learned a lot over the past couple of years around like white fragility responses, where we're really seeing a deep discomfort, particularly from white people in our nation that are confronting the harm that their own privilege and power is having within different systems and withdrawing from that. So I think a lot right now about what individuals can do. It can feel really overwhelming. So I recently had finished reading Ibram X. Kendi's book, How to Be Anti-Racist, which is a great read. But what really resonated with me was that this is ongoing work. This is not a checkbox that we can just simply say, oh, like I've read a book and now I'm an expert of this. But to think about our responsibility as individuals to really examine ourselves. And that includes our own trauma, that includes our own experiences, whether it's in the workplace or in our neighborhoods and in communities, and how all of that intersects with our power and privilege. And I think by really understanding those stories, we can be more sensitive to what are those feelings that start to arise wherever we are, whether that's guilt or anger or frustration, and how does that challenge our own self-view of self. I think another really powerful tool is just humility and leaning into the fact that we will make mistakes, that these are really kind of challenging conversations that we're having across the country right now. But even though we won't always get it right, there is an accountability factor of stepping back and understanding when we have caused harm. And when we do cause harm, what can we do to correct our mistakes, to have those crucial conversations, to acknowledge the impact on others, and to really be responsible to doing that work within ourselves offline, rather than kind of putting that emotional effort on the person that we've just impacted. So I think broadly, taking away from here, individuals really need to be more sensitive to both their internal self and to the experiences of others. And I think that's really what will drive some important conversations around all of this.
Thank you. Michelle, would you like to respond to that as well?
Absolutely. And thank you again for having me. I love talking about the state of DEI because it is so critical to the work that I do in public health. And from my viewpoint, having worked in different sort of arenas in public health, being at a public health department, working for a nonprofit, what I found is that for individuals, it's so important to, number one, start within your sort of sphere of influence, right? You will not change the world in a day. And we've seen some of the challenges that DEI leaders and professionals have faced over the past few months and years since things have sort of the post-pandemic era has occurred. So I would say, what can you do within the parameters and scope of your work that you can implement right now to sort of take that stand where you can have influence, but also sort of understand your environment and how to maneuver through that. I think it's also important too to have allies. Avery talked about sort of understanding where you are emotionally and mentally and stepping into that. But I think for me, as a person who was that DEI person or health equity, they have different names, but are sort of the same thing. It was so important to have support, whether it's internal or external colleagues, because this is definitely heavy work. And what I've seen and experienced is that sometimes the weight of this work is placed on one person or a few in an organization. And when we're talking about systems level changes that will not occur based on the efforts of one individual, especially dependent upon that individual's level of influence and power within that organization.
Yeah, thank you. So my second question I'd like to present, I'll go back to Avery, is that now that we've looked at it from an individual standpoint, what are some key things that organizations can do when really trying to identify where they fall on this whole equity systems continuum? And what are some tips that you might be able to provide to organizations who are really working to improve their equity engagement, their work, both internally and externally? Avery? Mm-hmm.
I think that's another really great question. What comes to mind first is really just the ability to, similar to with an individual, taking account and stock of where you are at, doing that work as an organization. So thinking about where are you currently, and the best way to get a pulse on that is really to talk to your people. I think sometimes we make a lot of assumptions at an organizational level of what are the root causes, what are the problems, but until we actually have the focus groups, do the interviews, do the pulse surveys, if there's an evaluation that goes out once a year, making sure that the questions on that evaluation really pull out and solicit, how are we actually feeling as a culture? What is it like to work here? Is there psychological safety? Do you feel that there is true inclusion in team meetings, or are you simply in a room taking up a chair? Not taking up a chair, but rather give you that. And so I think really trying to get at how are people feeling? And once you've collected that feedback and data, it's really important to share back the learnings quickly. I think there's a tendency to maybe really sit with it, wonder about the best solutions, wonder about what an organization can do to move forward with that data. But being transparent as soon as possible both helps to demonstrate the commitment to transparency of, we collected this, we heard this, we might not know the full solution yet, but we're committed to try to address it. And additionally, anyone who may have been feeling really isolated in a response might see that there's actually a cultural kind of issue that other people are speaking up about. And that can really empower more people to stand up and say, I want to be part of the solution. I want to think with you on how to drive change here. So I think collecting data, using it, being transparent about it, and then again, once you've collected data, really being accountable to doing something. So whether this is through work groups that people are invited to participate in from all levels, really getting everyone on every role that's adding to that solution is important, not necessarily just people in positions of power or decision-making authority, but starting to really shift that decision-making and drive to get at those solutions is, I think, helpful. Yeah, I think that's my general feedback.
Perfect. So Michelle, what is your take on that? And when we're working with organizations, what do you think of some things that they can do or some tips that, based on your observation, might help?
Well, we have less than an hour left, so I probably couldn't share everything that I am thinking, but to add to what Avery shared, I do think that it's important for organizations to acknowledge the harm that they have done in areas and whether it was intentional or not. And we know that, when you're working in public spaces, when you're working to support people, when we see the continuation of disparities in health inequities, we know that harm has been done, and it's not to be placed on those that are impacted by those inequities or disparities. So I think when we talk about transparency and communication, really being open about understanding the harm or the barriers that organizations have created for those that they were called to serve, and communicating that, not just within a report or an internal group, but communicating that to your stakeholders, your shareholders, to those that you serve, and really being open to hearing sort of that feedback from those different constituents to collectively come up with solutions on how to address this.
Great, thank you. And so as we move to our next question, but before we go to our next segment, I really would like to hear from you. What are a key strategy or tool you would recommend to MCH, maternal child health, or in public health practitioners who are invested in equity work? And so, Michelle, I'm gonna start with you first and then let Avery.
Sure. So as someone who has had the honor to work in maternal and child health for several years, serving families and communities and addressing Black infant mortality and Black maternal health, what I have heard from community health workers and from the residents that we served and from other colleagues is that that voice of those participants, the people being served, isn't present enough within those programs and the decisions that are made. And so I would say when we're coming up with strategies, when we're coming up with solutions, oftentimes in public health, it's very easy to look very much downstream and implement programs. We talked about the different systems, right? And sort of that savior design system of providing a program to sort of fix the issues that folks have or to fix people, but really not getting input from those communities and individuals, even as you're designing and developing programs, even as you're designing and developing policies, practices, and procedures, really having those voices at the table and not a proxy, right, from individuals who maybe work in systems, but really don't represent those communities. So that would be my sort of takeaway, is to make sure that voice and power that is in the community is actually there, helping to make the decisions and to design those strategies and policies.
Perfect, thank you. And Avery, what do you
I'm
have?
just nodding to everything you say, Michelle. That was, I couldn't agree more. I think that there's a I don't know, mantra that's often said, or that I've heard said a lot in maternal child health of, we need to make seats at the table. And so I even mentioned that earlier, but I think we actually need to flip the table over and think about how are we really thinking about inclusion? How are we thinking about what inclusion and belonging looks like, both from the start of a project design to all the way at the finish, that we're not getting to the point of collecting data before we've even had input from key stakeholders and people who will be most impacted by either the policy or program that's being designed. So I just really resonate with everything you shared. And I think the one thing I might add, or just have been thinking a lot about in terms of the teams that I've been on or organizations I've been a part of, is that there's really a definitive moment of taking time to define clearly what are the norms and the ways that we work together. So how do we kind of push against what is maybe a status quo norm of urgency? There's a lot of urgency in healthcare, but when we are doing things urgently, that might reduce the opportunity for more voices to be heard. So if we can work together to really think through how do we want to do this work and what are the values that we want to infuse across that, that might give us an opportunity to think about it both internally for our teams, but also externally with the groups that we're working with and really serving.
Thank you both so much for this discussion. I know we could go on and on and on, but we just wanted to scratch the surface, which we did. And now we're going to give an opportunity for our audience, our constituents that are here to join us today. We're going to give them time to engage with one another. So what we're going to do is we're going to break out into small groups where a moderator will be ready with some questions related to what you've heard today.
And Dr. Scott, can I stop you for a second? We're just,
yes.
We have an audience question. And so we're going to take this one question because we have a little extra time. Y'all did such a fantastic job. And so we're going to take a little extra time for this one question. And it's, Dr. West, if there's time, can Dr. Michelle or Dr. Scott unpack the word allies a bit more? Many organizations use this term, but I'm not sure everyone has a shared understanding, which can hinder authentic equity work.
Oh, that's an excellent question. Well, as we talk about that ally, even in our allied system. And I'll start, and I'm gonna let Michelle finish that. She can think about that. But ally can be very tricky. We throw that term around a lot. And what does ally actually mean? Of course, we want people to be able to work, especially as we're talking about racism and whatever, that people can be involved, that they can help champion exactly, the struggle and understand that struggle. Unfortunately, and a lot of times I think that, and I see Avery shaking her head, so I'm going to get her to that because she's more with that. But a lot of times people feel that they are allies, but really a lot of times they do more damage than it is good in that sense. And that, you really have to take an authentic look about what ally is. And ally can very easily become savior. And we see a lot of mishap when people feel that they are allies, but ultimately they become saviors. And saving is, let me do something for you. Let me help you because I know best, versus relying on the individual and saying, let me listen to you. What can I do based on what you feel is best for yourself? Now, that is really probably really one-on-one response, but that's what I see in my struggle in the work that I do, of that difference of people really understanding that. I'm going to give it to Avery, and then I want to then Michelle. So Avery, would you like to reply to any of that too, in regards to the ally?
I really, again, resonate with everything you shared. I think as a white woman who has been kind of navigating that question myself of what is the line between ally versus a fragility response, and just to be really open and honest and transparent about that. When I get tired of having conversations that can be tense, that can have a lot of stress in it, I have the option to tap out, right? And that's a privilege. So I think this question of allyship is, there's a continuum, and where we are along that continuum is not a badge of honor that we get to wear forever, that I am always going to be an ally, but it is contextual. It's based on the circumstance. It's based on the power in the room. It's based on the privilege in the room. And I think when we are navigating those different situations within our workplaces, within our neighborhoods, there's always an opportunity to kind of take a step back as an ally and say, is my role here to interrupt? Is my role here to support? Is my role here to amplify someone else's voice? And that's going to change depending on the context and the conversation. So it's a constant learning. And again, being really sensitive to how am I showing up in these different spaces, and being sensitive to the experiences of others, knowing we won't always get it right, but really working hard to understand the impact of our actions or of our inactions in those circumstances. But Michelle, I'd love to hear your thoughts as well.
Sure. And just very quickly, let me just clarify. I know I use the term ally. What I probably should have said is that you need a battle buddy, right? You need someone who is in this fight with you, and not just there to kind of pat you on the back, although sometimes we need that as well. And so from my frame of reference, when I referred to ally, really I was using it more of an informal word or phrase to mean someone who can really understand sort of where you're coming from, but also someone who might be in that fight with you, or can really be supportive of you, and not necessarily in the more formal or organizational sense of an ally, because I know that is a term that we are using a lot lately, and it has a lot of different definitions. So really someone who can support you, someone who may even have shared experiences, right? So that you can kind of commiserate together and have support as you go into your different spaces and champion this work.
Perfect. So now we're moving to our action steps. So, we asked the question earlier about what are some tools that people can do in moving toward becoming a more equity empowered system. And so I'd like to just go back to Avery and Michelle, and then I want to just give a few words and close out in regards to what those are. So again, beginning with Avery. Okay, what would again look at a key takeaway for action items in regards to becoming more equity empowered?
It's funny because I was actually just responding to a comment from Ken Harris in the chat on flipping the table and just thinking a lot about how this is both a from the design process of a program or policy, who is really informing, who are the decision makers, asking really, I think, key questions that we don't ask very often of, what are the ways that individuals within the community can really have the power to make decisions on where this program or policy goes. And I think another kind of piece of this is thinking about resourcing. So when we have the opportunity to make grants, sub-grants, think about how power and financing flows through systems, being really intentional and making sure that that funding is getting into the people who are really doing the work on the ground and within their communities. So that would be my action step, is let's flip the table right over.
Perfect. All right, our next action step, Michelle.
Yeah, so for me, it really is about empowering the community. So often I've been in spaces where I sat representing an organization or a system and was in a room with others that were called to serve, but there were no voices, no depth of understanding or knowledge of the communities that were actually being impacted and served. And so I think it's so important to elevate not just the voice, but to shift so that the power and decision making really is cradled within the community.
Thank you. And final. So as I close and thank all of you again for joining us, one of my hopes is that we have an opportunity to highlight some of the great researchers that are out there. Again, maybe not the traditional researchers that we hear from, but I want to close out with highlighting Dr. Tanisha Hill Jarrett, who talks about using radical imagination and being able to practice creative collaboration. And I'm just going to quote just a couple of things from an article, and I would suggest that everybody have an opportunity. It is called The Black Radical Imagination, a Space of Hope and Possible Futures. And as she starts out, she says that the radical imagination entails stepping outside the confines of the now into the expansive of what could be. It has been described as the ability to dream of a possible futures and bring these possibilities back to the present to drive social transformation. Our thoughts create our reality in a world where racism, sexism, homophobia, ageism, and other forms of oppression maintain a false social hierarchy and unequal distribution of power. The radical imagination is the foundation to re-envisioning the future and building a new balanced world, defined as the ability to imagine a world, life, and social institutions not as they are, but as they might otherwise be. The radical imagination brings possible futures back to work on the present and to inspire action. So with that, as I close, I feel that we need to all work and to work together to have courageous collaboration. And as she says in closing, while the word radical in today's and age often is a negative connotation and is used synonymously with extreme, radical is derived from the Latin word radix, which translates to root. And perhaps not coincidentally, the idea that our deemed radical are often grounded in the understanding or identification of a systemic inequality, oppression, and power imbalance as root causes of societal problems. To be radical in the truest form is to get to the root of the problem. And so with that, I would leave to say, let us figure out how do we get to the root of the problem. Let us figure out how we can come together collectively to be courageous, and that whether it's allies or whomever, that we can all agree upon that systemic change is needed, and that yes, we can and we will move to and along the continuum to become an equity empowered system and an equity empowered world. Thank you so much for joining us today. I'm going to turn it back over to Dominique, and I want to thank her for all her support and helping us along with our communications department here at NICHQ for all the work that we've done to bring this. So, Dominique?
Yes, thank you, Dr. Scott. And I'm just about to send my thanks to both of you, Dr. Scott, Avery, Michelle, for joining us today and really leading us in this conversation. As we can see, the chat was lighting up and the breakout room discussions were incredible. So really appreciate the three of you for leading us in this conversation today. And want all of you all to know that you can stay connected with NICHQ via email, social media, and our 2 podcasts, Before Birth and Beyond and Catalyst Conversations in MCH.